Now, we have to remember that we were progressing well, whether it is HIV or TB, well until COVID pandemic struck us. It reduced our own funds that could have come to it, mainly because COVID required huge amount of funds towards its own prevention and control activities as such. What is also important for us to remember that it led to health being prioritized at a lower level, and that has been further accentuated by the geopolitical tensions that we are currently passing through, and financing health is becoming an issue which is very much evident everywhere. Now, we heard lot of presentations. Some of the presentations which I can quote from the community which were important was Dr. Sita. She brought out an access related issue, which is part of universal health USC. No, that is something which is important for us to remember. Second thing, you looked at TAL. TAL is a comprehensive community-led service delivery model, which which is perhaps also important to reflect upon. You heard Bela, who talked about their approaches towards how to test those who are vulnerable, who are less than 18 years old, and they had their own innovations, which require a lot of advocacy if we have to do it everywhere. But we must also remember injection drug use was not a legally acceptable, it is legally tolerated issue which is currently being handled by HIV programming. So we don't know how we will handle this issue and whether we would be successful. To me, it can be a successful approach if we try to advocate for the same. And then we heard Happy, the person from Happy who talked about HIV, their work with the HIV infected individuals. And what they found was really well that those who were infected, they tended to adhere very well towards TB treatment per se, which essentially brings us to one thing that those who are health conscious perhaps are likely to adhere well, and they are a critical element for the success of any intervention that we would like to try. Now, if we look at this particular issue, we also need to look at how do we do programming across. When you reflect, we reflect most often now in high burden stage, whether it was for HIV, whether it was for TB. And then eventually, as the program matures, we tend to forget or give less priority to primary prevention. What we need to remember is we tend to intensify focus on those who are infected and vulnerable population. Do such compartments actually help us? Do we think that if we continue such an approach, even when it would come towards the disease elimination targets, to me, perhaps one of the issues that perhaps needs reflection is it is likely that keeping those away from primary healthcare programming perhaps will sustain stigma, and we will never be able to involve the community or mobilize the community in a strong possible way. If we balance primary and secondary prevention well, I think we will do well. And what we need to do in order to do that is involve all the population, even if they may not be infected. We can't forget primary prevention, and that balance has to be maintained really well. Now, what is also important for us to think about is, there are certain strategies which we haven't tried in the community. There used to be one model called as Community Opinion Leaders Model, which was also called as CPOL, where a community leader is sensitized and then he tries to ensure that the messages reach the population and people tend to accept their messages as such. So if we want to mobilize community, can we use CPOL like approaches? That's something which we should look at. Can we not use peer-led symptom screening at least, in order to see that those who perhaps appear to have symptoms which could perhaps be good for screening, can they be sent for testing ahead to a healthcare facility is something which we should reflect on, because this is not going to add to your cost. That becomes pretty easy to handle if we mobilize community in the right manner. When we think in terms of integration, what is it that we generally see? When we talk of integration, we try to integrate when the incidence goes down. And if we look at it at both the diseases, perhaps we are not at that particular stage. But is that the right model to look at for integration? Perhaps we need to evolve good models where you involve the community right in the beginning of such a program and sustain their financing and their role very strongly, even when the program tends to mature and is coming towards elimination. What is also important for us to remember that elimination will require a strong community mobilization. Otherwise, you will find that we may end up in having the same infections coming back again and again. What we need eventually, to summarize, evidence-based dynamic policy making. We need to use the modern technologies, including AI tools that would be available to us. We need to bring in accountability through community mobility, community mobilization, and community monitoring. We need to bring in transparency so that people can react and perhaps help improving the situation, local situation. And we need to have a decentralized planning for all such services to be provided, because one size will never fit all. And we need to have strategic reflections occurring at even the smallest of the units where we are going to operate. Community should also reflect on whether the level of advocacy that they need is happening in the right way. Do they need to have different communication strategies? Is something which they should reflect on. You need to involve civil society. Its involvement actually has to increase as we go towards elimination rather than decreasing at that particular point in time, because the task or achievements become more and more difficult as you go towards elimination. We need to involve younger population for giving sustained health messages in the community and ensuring that the community stays together and keeps on understanding the different disease dynamics that tend to exist. And we also need to ensure that these messages that we would like to provide from the younger population or younger age groups, they should not be only towards HIV, only towards TB. Perhaps they need to have all health related problems at a appropriate messages can be given to them through that, because universal health coverage would essentially require community. And if that has to happen, you need to have people who understand what is their own responsibility. They should be aware of all the symptoms that can occur, the major complications that can occur after an infection, and how easy is it to prevent. What is also important for all of us to recognize is the difference and try to ensure that health as a basic human right is accorded to people over a period of time. I'm sure together we will still work towards disease elimination targets strongly and ensure that every country will perhaps move in a manner that will be in consonance with what is expected from the programmatic goals. Thank you.
Thank you very much, Dr. Gangakhedkar, for your insightful remarks.